Yes, greetings to you. Hopefully everyone is doing well. I want to welcome you to HBMS TV, Talking Health. My name is Robert Samwez Masaka, the Director, Home-Based Medical Services International, and also the Director, Home-Based Medical Services Television. I want to welcome you to today's session. As you all know that HBMS TV is here to help educate you on how you can live a healthier life. So basically, this week in our health topical discussion, we are looking at a very, very vital condition that is disturbing very many people out there, and that is nausea and vomiting at HBMS TV Talking Health. These programs are proudly sponsored by Visionaries International, but more importantly, they're also sponsored by Mitiana Institute of Nursing and Midwifery. We send you greetings. Anyone who is out there and you're interested in being part of the Visionaries International, you're welcome. Or if you want to join the nursing institution, you're also welcome. So basically today we are going to be discussing about vomiting into details. And by definition, you is out there and you want to help someone, you want to guide them on how they can be helped, you need to know these things on your fingertip. For example, very many people out there have heard about nausea. But the question is, what is nausea? Nausea is the unpleasant sensation of the awareness of the urge to vomit. You feel like vomiting. Then there is what we call wrenching. Wrenching is the involuntary but unsuccessful effort to vomit. It is involuntary but unsuccessful. Then you have vomiting itself. This is a reflex expulsion of the stomach content via the esophagus and then the mouth. You expel out the content. But you need to note that vomiting follows stimulation of the vomiting center in the medulla of the brain as a result of sensitivity to either a drug or even metabolic disturbances. That is why you've had people, they tell you, when I take this drug, I vomit. Some people, even mere seeing the drug, they end up vomiting. I don't say if you're supposed to take drugs, don't take them. No, but it's just for general knowledge. And what are the causes? You is following us at HBMS TV. Among the causes, we have viral gastroenteritis, infection with the virus in the GIT. Then we can talk about bacterial infection. They're very common. You can even talk about motion sickness, talk about pregnancy, talk about the visceral pain, myocardial infarction. You can talk about migraine headache. You can talk about motility disorder within the gastro. Then Meniere's syndrome, psychogenic or anorexia nervosa. You can talk about peptic ulcers, diabetic ketoacidosis, cancer, chemotherapy, poor on treatment, then drugs themselves. All these are causes of vomiting. And you who is following us, you need to know what are the body contents lost during vomiting. What do you lose when you start vomiting? Vomiting is usually a symptom of an underlying condition, and the contents and color of the vomiters provides a clue as to what that condition might be. So you must be very sensitive. When one vomits, don't power away the vomiters before you take them to hospital. At times they may ask you, what is the color? How does it look like? As vomiting expels the content of the stomach, the pH of the vomiters is almost always highly acidic, because you know in our stomach there is an acidic content, and the acid creates a burning sensation in the back of the throat or the roof of the mouth or nose if the vomiters has passed through the nose. And vomit is almost always foul smelling. It tends to smell badly. Sometimes one can have vomiters with nothing in it apart from the swallowed saliva. Let me say they swallowed anything. And vomiting after eating usually expels the content of the stomach. Therefore, the undigested content that could have been in the meal is expelled out. There is also what we call blood vomiting or hematemesis. Fresh blood usually comes from the upper gastrointestinal tract, then blood lower intestinal tract usually appear brown in color, then clotted blood appears dark red in color, and is usually seen when there is a perforation. At times it is because of peptic ulcers, and this is an emergency. You need to treat it with care. And contractions of the duodenum, that is the upper part of the gate and all that, it can lead to secretion of bile, so the vomitus may look greenish. Then the other one, in case of intestinal obstruction, the vomitus may contain fecal matter. So this one also has to be treated with the emergency. You need to handle it very quickly. And what could be the complications of severe vomiting? Among the complications, a few of them, we have dehydration. Vomiting can cause the body to lose more fluid than it can take in, and it is very dangerous. Then we have hypokalemia, reduced potassium in the body than what is required. Then we have alkalosis. Metabolic alkalosis most commonly results from severe cases of vomiting that causes you to lose the acidity, the acidic fluids in your stomach. Then the other one, we have malnutrition. The body goes lacking the nutrients that are required. Then we have hyponatremia. It occurs with a concentration of sodium. Sodium is an electrolyte in your body, in your blood is abnormally low. When sodium becomes low, which is an electrolyte, and it helps you, this electrolyte here helps you to regulate the amount of water that is in and around the body cells. So you need to seek medical care for anyone who develops severe signs and symptoms of hyponatremia, such as nausea, vomiting, confusion, seizures, or even loss of consciousness. That is an emergency. And among the non-pharmacological measures or management, that is our focus as HBMS TV. We look at fluid replacement. Remember, when one is vomiting, is losing fluid in the body. Then electrolyte replacement, then appropriate diet. You need to also look at the diet of somebody who is vomiting, then avoidance of unpleasant odors. Just at times, people mere smelling something, they end up vomiting. Then management of underlying causes, the cause that is causing vomiting. Then take it serious when it happens in children and then the elderly. It is very, very common that you need to take note of that. And roles of supplements in vomiting. Remember, we have wonderful supplements that can help you. So for example, when we talk about vitamin B6 and vitamin B12, studies have shown that vitamin B can improve nausea and vitamin 12 can reduce the episodes of vomiting. And you need to talk to your doctor before adding any vitamins to your daily routine, or you can be your nutritionist. Many prenatals have the B vitamins built right in them. And food supplements are intended to correct also the nutritional deficiencies, maintain the adequate intake of certain nutrients, or to even support specific physiological functions. They are not medical products, remember, and as such cannot exert pharmacological or immunological or metabolic action, but they have a role they play. So the other thing you need to look at trying foods such as bananas. You can talk about rice. You can talk about applesauce, dry toast, soda crackers. These foods are called brat diet. For 24 to 48 hours after the last episode of vomiting, you need to avoid foods that can irritate or may be difficult to digest, such as alcohol. You can talk about caffeine. You can talk about fats or oils, then spiced food, then milk and cheese. You need to avoid them. And our recommendations are very simple. Complete is very vital. C24/7 is very vital. Angel is very vital. The Living Alkaline Coffee is very vital. And you who is following us at HBMS TV, you just need to know for dosages. You just turn back to the person who could have shared with you this link, or you turn to us, and then we will guide you on how to use if you're this victim who is always getting episodes of vomiting, episodes of nausea. I want to thank you very much for following us. And I also want to send greetings to our sponsor, that is Mityana Institute of Nursing and Midwifery. Thank you very much for always following us. And anyone who is interested in being admitted, you could be a parent, you just need to get to us through that number that you see down there. and you will be guided on how you can join that institution and have a productive child if you're a parent. And more importantly, don't forget to subscribe to our YouTube channel, that is HBMS TV Talking Health, such that every time we put something very nice for you, you can always get it. You can always be the first person to get the information. Thank you very much, and may God bless you. Thank you for being part of our health topical discussion that happens every Tuesday, and it is also on HBMS TV. And for those of you who want to always be part of this, you can always come inbox, you can always talk to us, and we can always connect you onto this program. Thank you very much, and may God bless you. HBMS TV, Talking Health.